BCEN Test Prep Exam Book PDF. Question 1. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain, option B, a damage at or below the midbrain/brainstem, option C, damage to the cerebral cortex, option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 2. Meningitis is an inflammation of the option A, a brain parenchyma, option B, manyings covering the brain and spinal cord, option C, peripheral nerves, option D, a ventricles of the brain. The correct answer is option B, manyings covering the brain and spinal cord. Question 3. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter, option B, prolonged QT interval, option C, Osborne, J, wave, option D, ST depression. The correct answer is option C, Osborne, J, wave. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A, normal cellular metabolism, option B, hypoperfusion and anaerobic metabolism, option C, kidney failure, option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 5. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils, option B, a unilaterally dilated and fixed pupil, option C, bilateral mid- position and fixed pupils, option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 6. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer, option B, intravenous diphenhydramine, option C, intravenous corticosteroids, option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Question 7. Priapism is a urological emergency characterized by option A, painful, prolonged erection, option B, inability to void, option C, testicular torsion, option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 8. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, a synchronized cardioversion at 100 J. Option C, immediate high minus quality CPR and defibrillation. Option D, a transcutaneous pacing. The correct answer is option C, immediate high minus quality CPR and defibrillation. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects option A, hemorrhagic shock, option B, neurogenic shock, option C, cardiogenic shock, option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Question 10. The antidote for acetaminophen overdose is option A, naloxone, option B, N-acetylcysteine, option C, flumazenol, option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 11. The best method to remove a prosthetic eye in an emergency is option A, Using forceps to grasp the prosthetic. Option B. Applying suction with a bulb syringe. Option C. Using a suction cup designed for prosthesis removal. Option D. Sweeping a finger around the edge to break the suction. The correct answer is option C. Using a suction cup designed for prosthesis removal. Question 12. The most common cause of airway obstruction in an unconscious patient is option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. Question 13. The most effective method to control severe bleeding from an extremity wound is option A. Elevation. Option B. Direct pressure. Option C. Pressure point compression. Option D. Ice application. The correct answer is option B. Direct pressure. Question 14. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A. Hyperkalemia. Option B. Hypercalcemia. Option C. Hypocalcemia. Option D. Hypermagnesemia. The correct answer is option C. Hypocalcemia. Question 15. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option B. Keep the patient NPO and provide aggressive fluid resuscitation. Question 16. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 17. The priority patient for a trauma team activation based on mechanism of injury is option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 18. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A. A patient fall that results in a minor abrasion. Option B. A medication error that causes no harm. Option C. A surgery on the wrong body part. Option D. An AMA discharge. The correct answer is option C. Surgery on the wrong body part. Stressed about your CSN exam? We can take CSN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The golden hour for acute ischemic stroke refers to the window for option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. Question 20. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 21. A patient leaving against medical advice, AMA, must be informed of option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 22. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 23. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 24. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 25. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management.